Good day, everyone. Welcome to another episode of Collaborative Connections, a space for sharing and learning sponsored by the Society for Oncology Massage and the Society for Oncology Aesthetics. My name is Erica Clinton, and I will be your host for this episode. On today's podcast, we have Nicola McGill. Nicola has been an aromatherapist for 25 years. She started her aromatherapy practice in England, focused on supporting women with aromatherapy during their pregnancy. In 2003, she relocated to the United States, where she and her family ended up in Boulder, Colorado. Nicola began working as an oncology massage therapist at Boulder Community Hospital at their Center for Integrative Care, where she supports oncology patients in an inpatient and outpatient setting with gentle massage techniques, reflex touch, lymphedema management, and breast cancer rehabilitation. She works alongside other members of the center's team of complementary care practitioners, which also includes a breast health navigator to provide support and gentle healing to cancer patients on the journey to recovery. She is involved with educational talks and discussions, both at the hospital and in the Boulder community, on aromatherapy, lymphedema management, oncology massage, and the importance of a more gentle approach with body work for the cancer patient or cancer survivor. She is also an educator providing classes to oncology massage therapists, and she has presented at the S4OM Healing Summit. Thank you so much, Nicola, for taking the time to join us today.
Thank you for that beautiful introduction. I appreciate that. Thank you.
Well, it was like amazing to look at your bio, and I was kind of like editing and figuring out, I was like, okay, we're going to talk about this, but your background is so amazing. But what I'd like to do is give our listeners a little bit of knowledge information in terms of understanding what inspired you to become an aromatherapist 25 years ago.
Well, that's quite the interesting story, because I left school very early, left high school very early, lots of different reasons for that. And I was lost. I was really lost. And I remember having the conversation with my mum, and she said, you got to figure out what it is that you want to do. And I was going from little job to little job, working in retail and, just figuring things out. And she said to me, Nicola, you're really good with your hands. And I'm like, okay, what does that mean? Is that art? Because I can't draw. I'm useless
Right.
at things like that. And she said, you just have this ability, to touch. I had grandparents and I would often just massage their feet, massage their hands. She said, maybe that's the field that you want to investigate further. And at that time, in the 80s, aromatherapy was becoming very popular. I mean, it's always been popular in Europe, but it was becoming more and more popular. You could buy essential oils in a local pharmacy, etc. And I just had heard about it. And I thought, that might be a good thing for me to study rather than just, doing massage. I wanted to learn more about aromatherapy. And I think I was also intrigued by nature through my grandparents, to be honest. So I decided to attend aromatherapy school, and it was just one of the best things I've ever done in my life, apart from having my children, obviously. But it wasn't just about massage and touching and healing people. It was using these gifts of nature to assist people in their healing process. And I was learning so much about the human body as well, and the integration of, aromatherapy, essential oils, nature's gifts to assist with that healing. And the school that I went to, I initially went to an aromatherapy school, and that's when I got pregnant, and I didn't complete that training. That's when I eventually went to the London School of Aromatherapy. But my first place of instruction was in a place called Tunbridge Wells in England. And my instructor was very much she taught us iridology, to how to look at somebody's eyes to see what was actually happening with their body. We learned reflexology or reflex touch to figure out what was also happening. So she really taught us this holistic approach, looking at the whole person and what's going on, how can we support, not just with our touch, but how we can incorporate essential oils into the practice. So for me, and I just love scent, and I love the fragrance and the way that these essential oils, the life force of a plant, and how we can use them with the human body. It just started the journey. So thanks to my mum, who was like, Nicola, you got to do something. You're good with your hands. But there was that ability to, yes, use my hands, but you also use the power of nature and the gifts that we're given to heal and assist with people. So
That's wonderful. And so lovely that your mom was part of that journey.
yes, she
My
was.
parents were absolutely horrified that I was going to become a massage therapist.
Oh, really?
Yes.
Wow. Okay.
Um, but they changed their mind very quickly when they realized that it was a real giving profession.
Giving profession in so many ways, because you give with your hands, but you're also giving with your heart and your soul and your that caring, nurturing aspect. And for me, that bringing in the aromatherapy was another addition to that.
That's
I bet they're
wonderful.
proud of you now, though, Erica, right? My gosh, what you've achieved too.
Yes. Yes. And all because of everything that they gave me, as well as the opportunity to make my own decisions about what I did, which
Mm,
I greatly appreciated.
yeah.
But talk to us a little bit about why aromatherapy is so effective from, I guess, a wellness or even just with people who have chronic illness. Like, why does it benefit in those two realms?
Well, first of all, aromatherapy, the use of essential oils, has been around since records first began, back to Egyptians when they were using essential oils for the mummification process, to the ancient Greeks, to even Hippocrates, who, the father of medicine, talks about the use of essential oils and nature's healing plants, herbalism, that kind of thing. And I think that it's, to be honest, it's one of those modalities that we can use to treat the person in a holistic viewpoint. So it's a holistic treatment. We're treating the whole person, not just the ailment that they're coming in with. And I know with massage therapy and many other modalities, we still do that. We're looking at the whole picture. But I think, one of the key things I think for me as well with aromatherapy is think of the word. I love words, by the way. Words, I think the way they're put together is amazing. But aromatherapy, aroma. What is an aroma? Aroma is that smell, that fragrance, that connection that we have with which actually olfaction is the process of smelling. It's
Mhm.
connected to our limbic system, our most ancient part of our brain. And this is linked to our memory and our thoughts and our feelings, that whole kind of connection. So I think people are recognizing that. And again, I'm just talking about the aroma point of view right now, not the therapeutic benefits of these essential oils. But I think that in itself, if something smells nice, we feel good, right? Wherever we're at, we can take an orange and we can peel an orange, and the smell of, when we peel the orange, we're actually bursting the little sacs where this essential oil is. And it's uplifting. It's reminding us of something fun. I mean, I remember, just the smell of oranges makes you feel like you're on vacation,
Yeah.
right? So
Yeah.
there's that element of aromatherapy becoming, it's uplifting. But I think as well, when we start to talk about the therapeutic benefits of essential oils, and what I want listeners to appreciate here is that essential oils are kind of the life force of a plant or a plant material. And that essence, that life force is extracted from the plant material to become a very concentrated, what we call an essential oil. So again, it's got all these different chemicals. And I'm not talking synthetic. These are all natural chemicals that all have the ability to have an action on the body or in nature in itself. And if you think about plants and their ability to protect themselves out from insects and pests and things like that, they all have these chemicals inside that create that environment for them. So with aromatherapy, the ability has been to extract this from the plant that has therapeutic effects on the body. So you've got a combination of the therapeutic effects as well as this aroma. And it's a way, I think, again, going back into the 80s when it was becoming more and more popular to use, it was a way of like taking care of ourselves. And I think
Mm.
a lot of people see that as a way of taking care of yourself. And with the increase in the amount of books now on aromatherapy, like I was pretty limited when I was in school and we had the standard ones to use, but so many more are out there now because so many more people are doing the research and can appreciate how wonderful these are. Although having said that, one of my concerns as an aromatherapy is sustainability.
Mm,
Big thing. We have to be kind of mindful of that, and I remember when I was doing my initial training, how using sandalwood, I mean, it's one of my favorite essential oils, but it's now, in danger of becoming extinct because of its overuse, and there's
mhm,
new variants on it. So there's lots of things to consider around that, but we are able to. I think the key thing around it is being able to treat the person as a whole,
mhm,
holistically, using the aromatherapy. And I think people are just seeing the benefits of it.
mhm.
More people that are using it, it's more accessible to people than it ever was. And people are, even if it is just from the aroma and the olfaction of that essential oil, I think that's benefiting people, if it
Mhm.
more than anything, the mind. And we know that when we can soothe the mind, calm the mind, put the mind into a better place, we're more able to move forward with whatever healing we need to do.
Yeah.
Yeah.
I remember when clients would ask me to use oils with aromatherapy in them, I would always say, well, why would you like that? And most of the time they would say, because it smells good. And after a while, I said, you know what? That's really got to be a good reason,
Yeah.
is that something brings them that joy or calm or
Yeah.
good feeling.
The thing is as well, because it's, olfaction's connected to our limbic system, which is the system for memory. These aromas, these I don't like to use the word fragrances because we think about
Mhm.
perfume as that, and that's
Yeah.
more synthetic. But these aromas can transport us back to a place of good times, good memories. I will say though, that, and this is why you have to be careful with the oils that you use sometimes with clients, is that it can also transport them to a place of a bad memory.
Mhm.
So, that's something we need to be mindful of as well. And that's one of the key things when I'm working with cancer patients is like, I don't want to bring forward a memory of, maybe we used an oil when they were going through chemotherapy, and then years later they smell that oil and it takes them back to that place, so you have to be careful with that. But
Mhm.
generally, a lot of these essential oils and the aromas from the essential oils can really transport you back.
Yeah. So it's like thinking about them on a continuum. It's like they take a person kind of through their life and bringing in something that, you remember very wonderfully from your childhood could be hugely helpful, but also remembering things that may be associated with more difficult times.
Absolutely. My grandmother used to there was a company in England called Yardley, and they used to make this Lily of the Valley fragrance.
Mhm.
And it was what my grandmother, she wore all the time. And my grandmother, I spent a lot of time with her because my mum was very young when she had me. So I spent a lot of time with my grandmother, and she would wear this Lily of the Valley. And she passed away, gosh, almost 20 years ago now. And I still have it's a talc, and I smell it, and that's my grandmother. That's my grandmother.
Well, yeah.
So I mean, it's not an essential oil, but it is so true how these aromas can transport us back and bring a sense of comfort at
Yeah,
times when we need that. Yeah, for sure.
absolutely. Absolutely. So you mentioned something that I'd love to talk about for a few minutes, which I never thought about, which is sustainability,
Hmm.
right? And I don't know why the idea that there are essential oils or plants that these essential oils come from that are being over farmed, I
Yeah.
guess,
Yeah.
and then could possibly be extinct. And I also then started to realize that maybe growing a plant to get an essential oil, requires that you follow a specific time frame. You don't harvest it too soon.
Mm.
You want to let it age and grow and develop all of those magical properties. But are there things we as massage therapists can be thinking about with aromatherapy products and sustainability?
I mean, one of the key things that I'll always tell people if they're looking to work with essential oils is, who are you buying your oils from?
Mm,
What are their ethics? Where are they purchasing these essential oils? Are they, purchasing them from, regenerative farming? and, distillation processes. And it's just the ethics around it and, where they are actually getting the essential oils from.
Mm.
I use only a very few suppliers of essential oils because I know that they follow the guidelines of sustainability and they're not, sourcing them from places where, for example, like with the sandalwood, I
Mhm.
now Australia and you can get Hawaiian sandalwood, different types of sandalwood. They're places where they're doing, they take down the material, they produce the essential oils, but then they'll plant more trees or, just, I think it's really important from where you purchase your oils from and do the research.
Mm.
And I don't want to be disrespectful to any essential oil company out there. I mean, we've all got our roles and our jobs to do, but I just think it's important as a community, if we are going to be using essential oils on such a large scale, which we are now. I mean, you
Mhm.
can go into any, all these different stores. You can buy oils on Amazon. I mean, they're absolutely everywhere. And it's like,
Right.
where are they coming from? And I
Mm.
think it's our responsibility. And I think it's the same with anything that we do as human beings now on this planet. We need to be more mindful of what we're doing, sustainability with everything and how we're using things. And I just feel that it is really important for you to really check into your sources.
Wonderful.
Okay, then.
Thank you.
Yeah.
Thank you for that. Now, when we were getting ready to do this podcast, you acknowledged that aromatherapy had led you to a love for lymphatics.
Oh, yeah.
Can you tell us a little bit about that and how that came to be?
So, like I mentioned earlier, the first aromatherapy school that I went to in Tunbridge Wells, my instructor, and I mentioned how she taught us about iridology and reflexology. When she taught us the massage techniques for applying essential oils in an aromatherapy massage, she spoke highly of the lymphatic system and she showed us some techniques to use
Mm.
in the massage. And I just, it was just one of those things. Again, I was intrigued. I saw the benefits from it. And the lymphatic system was even, back then, it's been the lymphatic system and the awareness of it has been around for many, many years, but it's become more popular over the past 10, particularly here in the US. When I first moved to the US, nobody knew what it was. I had to
Mhm.
really do a lot of education. But it's been used in Europe for many, many years. But she really just encouraged us to, when we were using the essential oils in massage, incorporate some manual lymphatic drainage techniques. So she, again, was my inspiration for that. And like I said, I didn't finish that school. I
Mhm.
had my first son, and then I had my second son. And then I thought, right, no, I've got to finish and get my diploma in aromatherapy. So I actually did. That's when I went to the London School of Aromatherapy, got my diploma. And then it was a few years later that I was doing my continuing education, as we do.
Mhm.
And actually, in my local town where I lived, there was a large oncology conference, and one of the local oncologists had set up a foundation with a lady called Helen Rollison. She was a BBC sports presenter, and she'd gone through cancer herself. And unfortunately, she didn't survive, but she set up a foundation, the Rollison Foundation at the local hospital. And she was, again, all about cancer patients need access to complementary healthcare. So this big conference was put on by her oncologist, and aromatherapist came to speak about the role of aromatherapy in oncology. And my old instructor, she was there, and she was giving a breakout session on manual lymphatic drainage. So I attended and I said to her, I have to learn this. I just have to learn this. This is just something, you gave me the inspiration. And that's when she said, okay, I'm teaching a class at the local university, and it was a 3-month program. And I went and done it and got my diploma in manual lymphatic drainage. So I had an insight into the lymphatic system very early on. And when I first went into my aromatherapy journey, so it was aromatherapy, lymphatic journey, iridology, reflexology, all of it all at once. But the
Mhm.
lymphatic system stayed with me, as did the aromatherapy. But
Yeah.
yeah, that's how I got interested in that. And when I moved to the US, like I said, I tried to educate people around the lymphatic system, and not a lot of people knew what that was. And it wasn't until I was employed by Boulder Community Hospital in the oncology setting that the awareness of the lymphatic system became more prominent and more understood. And my manager at that time said, well, this is great that you've got this background, which was, and I used it with my oncology patients, but then from there I was seeing lymphedema, lymphedema. And that's when I became a lymphedema therapist.
It's amazing.
Yeah.
So, in terms of aromatherapy, are there essential oils that enhance the manual lymphatic drainage or are better at supporting the lymphatic system?
Yes, there are. There are, you can go through a lot of different research and data about oils that support the lymphatic system, which are ones that I do use. Oils like grapefruit, but grapefruit you have to be careful with because it can be phototoxic and lots of different things around that. Oils that support circulation, geranium is a good oil. You can use juniper. It's known to be a diuretic. But one of the things you have to take into consideration when you're using these essential oils, two things. One thing is I'm not just looking at their lymphatic system. I'm looking at everything that's going on. And so as a holistic aromatherapist, that's what I'm doing. So yes, it may be addressing the lymphedema and a sluggish lymphatic system, but I'm also looking at other things that they may be experiencing. Maybe their circulation is poor, so maybe I'm incorporating an essential oil that will help stimulate their circulation, like ginger, or they've got pain and I'm incorporating an oil for pain, or they've got digestive issues, muscular issues. So there's that, that's where you're just bringing in not just one essential oil, right? You create a synergy. And then secondly, I think you have to also be mindful of what is resonating with your client. Because we can put together all these essential oils, think, oh, that works for this, that works for that. And you can put that blend together and your client may be like, I'm not liking that aroma. That's not doing anything for me. So
Right.
despite you've got, all these oils, because these are the therapeutic benefits, you've got to come also from a place of what's resonating with that client and what do they enjoy. What gives them that sense of calm, get that sense of wellness. And we don't, again, not to create a negative response by using these groups of essential oils. But yeah, I certainly do use, my grapefruit. That's one of my grapefruit and geranium are very, very common. I sometimes use some cedarwood or some cypress because, again, they're just more on the circulating. But I would say to anybody that wants to use aromatherapy with their manual lymphatic drainage to, look at the whole picture and not just focus on, that oil I've read because that's good for circulation. There's many other benefits for those oils as well. I get asked this question a lot, by the way, from my students that take my MLD training. They're always like, oh, what essential oils? And I am going to try and put together some kind of class for, lymphatics and aromatherapy at some point.
Oh, that would be wonderful. I just finished my lymphedema management training
Oh, you
and
did.
yeah,
Fantastic. Congratulations.
thank you. Thank you. And of course, the moment you can do something, it's
Yeah.
like the universe opens up a tap and people just come at you
Yeah.
from all over, people you didn't even know were struggling with something. And so it is taking over most of my practice, which I'm very excited about. And so
Yeah.
now just in thinking about adding aromatherapy, I'm like, oh, that might be really wonderful.
Yes. You have to be careful, though, when you're working with patients with lymphedema.
Mhm.
It just depends on the extent of lymphedema and what their skin is like. Because again, with lymphedema, as you know, it can change the skin and you just have to be mindful of that. And a lot of the time with lymphedema patients, they have to have special skincare in order to maintain skin integrity. But, that's where aromatherapy can help. There's so many oils that support skincare. Oils like frankincense and myrrh are really known for being
Oh,
regenerative on the skin.
that's
And they're antimicrobial, antibacterial. So again, they can really support. I mean, I use them a lot for people that are at risk of cellulitis
that's
as
amazing.
well. Yeah,
And good preventative care, which,
exactly.
with lymphedema management, I feel like is half the battle. It's like the
Yes.
anticipation and watching for things and anticipating potential things that could be more problematic.
Wow.
Um,
Erica, how do you have time to do all this? You're a lymphedema therapist now and president of S4OM and all these things and a massage school. My goodness. Well done, you. That's really good. We need more lymphedema therapists for sure.
And as I've reached the point of no sleep, I'm deciding to pull things out of my life, which is good. Like you
Yeah.
said, like organizing it so that I can manage what I can manage and, also moving on from some things into another. So
Mhm.
lymphedema management was the progression of my massage work, which initially was very much about deep tissue medical massage. And now into my 50s, I'm like, not anymore. I want to do another 20 years. And I needed to find something that was a little bit more user friendly for me.
Mhm.
And so oncology and lymphedema management have now become basically my whole practice. And I
Right.
love it
Yep.
because there's so much you can do. But I guess, from my own education as well as for our listeners, if someone does have oncology massage training and they are looking for a course about aromatherapy, not even thinking about hours, but what should some of the components of that course be? Because I feel like aromatherapy is almost like chemistry. You really need to understand a bit. You need to look at
Mhm.
your risk, your benefits, and a lot of that is going to be about how you apply or what you apply to each individual person.
You said had a very valid point there, Erica, because aromatherapy is about chemistry. And I say this to my students all the time. I totally disliked chemistry, totally disliked it, couldn't get on with it. I studied some nutrition. I went to nutrition school a little bit and had to do this whole chemistry course. And I was just like
Mm,
pulling my hair out. But life is chemistry. Life is
yeah.
chemistry. And I think what's a really key component that you brought up is that aromatherapy is chemistry because
Mhm.
essential oils are made up of numerous components, all carbon based, and they all have their natural chemicals within a plant that are extracted from the plant to create this highly concentrated mixture of chemicals. Your ketones, your monoterpenes, your sesquiterpenes, your all these different kind of components. And they and then this is another thing. A lot of the time people think, oh, aromatherapy, it's natural. Natural's really good for you. Nature can kill you.
Mhm.
No disrespect. And I'm not saying that aromatherapy is going to kill you, but we have to be respectful of the fact that these are, natural substances that can kill people. That's why some plants do. If you eat a plant, it can kill you because it contains all these kind of chemicals. So I think it's important that if you do any aromatherapy training, you have a good foundation of understanding the chemistry. And I'm not saying you need a degree in chemistry, but you need to have an understanding of how these chemicals interact, especially when they become present within the human body. And
Mhm.
this is one of the reasons why, I'm not a big proponent of oral ingestion of essential oils because, again, we don't know how they're interacting with the body. And, in Europe, you can only really ingest essential oils if you're a medical practitioner. So if you're a practitioner that studied in that. And so, having a good foundation and with the chemistry and also safety and knowing about what are safe dilutions. And again, all essential oils should be diluted. You should never use them neat in any shape or form. They need to be diluted in a carrier, such as a
Mhm.
vegetable oil. And also someone that's going to really kind of explain, that holistic use of them, how you make blends and how you can create a synergy, understanding, the different chemotypes. Chemotypes is a big thing in the world of essential oils because it can be the same plant, but they have what they call different chemotypes. So
Mhm.
there's different chemotypes. And so understanding the Latin names as well for each of the
Mhm.
plants and what the plant families. So I think there's quite a few good courses here now in the US. And I mean, I'm not going to mention names, but I'm sure people wanted to get more information they could from me or yourself. But there are a couple of classes here that, at least a 200-hour program. If you,
Okay.
at minimum 200-hour program, if you are going to really look at using essential oils in your workplace. Obviously, there's more extensive programs if you want to become a clinical aromatherapist. But, a weekend workshop is it's not going to give you enough information
Yeah.
to use it safely. And we have to remember that these essential oils, when they do get into the body, whether it's from olfaction, where these molecules reach the cilia in the nose and get into the body that way, or we're applying them on the skin through a carrier, that a certain amount of them are going to be absorbed. A lot of the time when we apply them to the skin, they evaporate. Essential oils do evaporate. And that's another thing you can learn about your heavier notes with the oils, with your base notes and your top notes, etc. But the body, in fact, your liver is your detoxification organ. Your liver takes all that on board and, breaks them all down before they actually get to where they need to go. And so that's where, when we do use essential oils, we also have to remember that, as much as that concentration is, it's not all going in the body. The body's going to break it down. But you still need to be mindful with your level of dilutions depending on who you're working with, particularly oncology clients, because they are already processing their chemotherapy, their immunotherapy, their radiation, the impacts of anesthesia for their surgeries, all of these things that, as obviously all oncology massage therapists know this, so I don't want to be preaching to the choir here. But then when you add, they've got their medications and then you add some essential oils, you want to just make sure that it's just, appropriately diluted for where they're at right now. And it's the same, with pregnancy. You want to, we watch our dilutions with pregnancy. You watch your dilutions with the medically frail. But that's where good level of aromatherapy training can help support you so that you can, first do no harm and mainly support your client.
Wonderful. Chemistry. Absolutely.
Chemistry. I mean, even when we cook, that's chemistry.
Right.
And
Right.
it's so interesting to think about it in that way, because we just don't. We just think of equations, and that's the worst thing for me with chemistry. I mean, I find it fascinating, but equalizing all the equations is like not good for me. But everything we do is chemistry. Even when we put something on our skin, we cook, we make a cup of tea. That's chemistry. That's the components from the tea leaves, moving into the water. So we have a respect for that. And you're talking about, getting into your 50s. I'm in my 50s, probably a bit more than you. I'm halfway through my 50s now. You appreciate things differently, so much more. And you can see how it all relates to how we are as human beings.
Yeah. You appreciate more, I think, also.
Yeah,
Yeah.
I do.
So things can be more subtle and
Yeah.
still magically beneficial.
Yep.
Well, thank you so much, Nicola. I've
Oh,
enjoyed this
you're welcome.
so much. It's been a real pleasure. And I think we touched on a lot of things that'll be really good for our community to hear.
I hope so. I hope
and-
so. I hope
and I'm
it's been
really-
some inspiration too.
Oh, good. And I'm really looking forward to seeing you again, hopefully at one of our events, our
Would
healing
love to.
summit, something, because you're wonderful and you have so much to share.
Thank you. I am so grateful that you've given me the opportunity and to be able to be part of a community that's all about helping others and supporting others on whatever stage they are of their journey.
Thank you.
Thank you.
All right, collaborators, have a great day.
Thank you for listening to S4OM's Collaborative Connections podcast. If you found the information we shared today insightful and valuable, share this episode with a friend, or let us know you love this episode by tagging us on social media. Our goal is to bring the oncology massage community the latest research, education, and best practices possible. We love hearing from our listeners and welcome your thoughts and suggestions for future episodes. If you have any questions or feedback, you can email us at podcast@s4om.org. Until next time, thank you for listening.